Neuroscience Disease Presentation by Ali McCullen, Nora Lee Beecroft, and Nora Hagigi. We did our presentation on the treatment and diagnosis of multiple sclerosis.
Hey Mom.
Hey Nora, how's school?
I'm kind of bummed. Today was really weird.
What makes you say that?
I just felt off the entire day. You know history is my favorite class, and I usually pay so much attention. I had zero attention span, and I couldn't focus on anything the teacher was writing.
Weird.
And then on top of that, everything that was written started to appear in doubles, and it was blurry.
Did you get a good night's sleep last night?
8 hours, yet I still felt tired the entire day.
I feel like that's a normal amount you usually get.
It is, and I couldn't even distinguish the colors that my teacher was writing in on the dry erase board.
Wow.
And then I didn't think I drank that much water, probably the usual amount, but I had to use the restroom 5 times during class, and that's never happened to me before.
What do you think that could be from?
I have no clue. And then, okay, I consider myself a pretty good softball player, but I couldn't catch any balls today. It's like my coordination was completely thrown off.
That's so strange.
What should we do?
I don't know. Maybe we should just keep an eye on it and maybe get a good night's sleep tonight and we can just see what happens tomorrow.
Okay.
All right.
So I'm all packed, which is good, because tomorrow we'll just be ready to go.
Okay, just make sure you set an alarm.
Yeah, absolutely.
Hi, how are you? I'm Dr. McCullough.
How are you? I'm Nora.
Hi, I'm Nora Lee. I'm your mom. Hey, nice to meet you guys.
Nice to meet you.
What brings you in here today? So quite a few things, right?
Yeah. So I'm a little scared, Dr. McCullough, I'm not gonna lie, because I know I just have not been feeling like myself recently. There's definitely something off. I get at least 8 hours of sleep a night, which I feel like is a pretty normal and standard amount, yet I feel fatigued all the time. I have this sense of dizziness all the time that just does not go away. I've never experienced that before. And then the other day, something really scary happened. My entire left arm just went numb, and it was this tingling sensation. And I seriously thought I was having a heart attack.
We actually called the paramedics and everything, and they ran into the hospital, and everything seemed to check out. They just said, you know, checking with the primary care doctor the next day. So.
Yeah, so I'm definitely glad you came in today. It does seem things are a little off. Have there any big changes that you've experienced? Lifestyle, diet,
I don't think so.
exercise? No, not
My
anything.
diet's been pretty standard. It hasn't really changed. Nothing that would change anything internally. And I think I work out like about 2 to 3 times a week. So I'm pretty active.
So as your mom, have you seen any firsthand any behavioral changes? Anything other than the stuff she just told me?
So honestly, just going to her games and stuff and just trying to support her, I've noticed that there's kind of been like a lack of coordination. She's usually a pretty good athlete, and I just kind of noticed things just seem to not be, you know, she doesn't seem to be operating at like 100%. So
Yeah, my coaches have been noticing and asking me what's wrong. They even asked me if something was happening at home, but it's just something wrong with me.
Yeah. So how long do you think that this has been going on?
I would say around 2 to 3
I
months.
would say about the same.
So with any of the lack of coordination, have you experienced any loss of vision, anything in
You know,
that
now that
area?
you say that, that's interesting, because we have an appointment for the eye doctor next week.
Yeah,
Because I've been having some blurry vision. Sometimes I see doubles.
Okay.
And I've never experienced that before, so that definitely raised
You've never had any
some
head trauma or
concern.
anything.
So
Okay.
I'm not concussed.
So I took all your vitals, or the nurses did, and they all seemed to check out pretty well. And I did also review your medical records. I did see the history of heart disease, but all the things you're explaining can also be related to the numbness you felt in your arm, so I don't really think that should be it. But I was wondering, are there any other neurological diseases that you remember from your family?
Like running in the family.
Yeah.
The only thing I can think of is your aunt having MS.
And she has multiple sclerosis.
Okay, so I don't want to alarm anyone. That can be hereditary. Doesn't mean necessarily that's what's going on here. But a few of the symptoms could lead up to that, but it also could be numerous different things. It could be a common mono, all that kind of stuff.
So do you think that what's going on with me is neurological?
I think a lot of things you described can lead to that. At the same time, I'm gonna have to run a lot of tests. So there's
What kind of
exactly.
tests are you thinking?
There's not exactly one test that I can use to rule out a bunch of different things at the same time. I'm kind of just have to do a few different things to narrow down the list. So I'm starting out with maybe a blood sample today, if that's okay with you guys. And then from there, if things still aren't looking the best, I might go ahead and go with an MRI. You might have to check into the hospital for that a little bit later. But I just want to rule out some of the other common diseases just so we can know if this is something to really be worried about or this is just something going on that can be taken care of easily.
Perfect.
So if you want to come with me, I can go ahead and take your blood.
Awesome. Okay. All right. Let's do it.
Okay, so I just got the results back from both your MRIs for both your brain and your spinal cord. And at this point, I do think I have enough information that leads me to believe that you should be diagnosed with multiple sclerosis. And I know that can seem scary, but I'm going to walk you through it. I'm really going to explain to you exactly what that means is going on in your body. And after that, I'm also going to tell you exactly what treatments we can take and what steps in your lifestyle that you can take in order to prevent it from spreading even further. So this is the first scan that we took of your brain. As you can see, the major differences are the white lesions that are present. So this is not present in what we'd say a normal brain is, so someone that does not have multiple sclerosis. As you can see, the spinal cord MRI is also the same way, like you can see the lesions as well. So this would basically show that in order to diagnose MS, we have to see lesions in 2 different parts of the body. So they also have to occur at 2 distinct points in time. And at this point, both of these have been happening in your body. So,
To be honest, at this point in time, I'm really confused and scared. Is there any way you could break it down a little further for me?
yeah, of course. I can take you into another room and really break it down for you and show you exactly what's occurring, not just in your brain, but break it down even further into your neurons and even smaller parts of your brain, so you really have an idea of what's going on.
Perfect, thank you.
So first I'm going to start out by drawing a normal neuron. There's the neuron, and these little boxes that I'm beginning to draw is known as the myelin sheath. So myelin sheath represents an insulating layer that forms around neurons that is both in the brain and in the spinal cord. These layers of myelin sheath are made up of proteins and fatty substances. And this not only provides a layer of protection for the neurons, but it also allows electrical impulses to transmit between the same neuron as well as from neuron to neuron. So here is what is known as a damaged neuron, which is representing what's occurring in your brain currently. So as opposed to the normal neuron where it's protected by these myelin sheath layers, the myelin sheath is attacked by your own immune system. So this myelin sheath is the fatty substance that is made up of oligodendrocytes that protect your nerve cells. In turn, after this protection occurs, the nerve cells end up having no protection and eventually become exposed, which leads to the nerves deteriorating over time and can become potentially damaged permanently, unfortunately. So since it affects the neurons in your brain, this can lead to damage in numerous different ways, such as thought, perception, speech, eyesight, and muscle movement, which is a lot of these symptoms you've described to me. So this destruction of neurons is also gradual, so it occurs at different paces for every patient. A good way to think about this disease is to picture a normal neuron as a wire. Now think of that wire being stripped of the outside layer that holds all the different wires together inside. Now all the different pieces are exposed with the wires having no protection. That's the difference between your neurons as compared to what occurs in a normal neuron. So after explaining to you exactly what's occurring in our body, I really want to go through and tell you the steps that we should take in order to hopefully stop it in its tracks or at least slow down the progression. Unfortunately, at this point, there's no cure or anything to make her completely back to where she was, but there's a lot of different medications and lifestyle changes she can use in order to diminish the effects and just to make her feel better, have a better quality of life, and really just also at the same time make sure it doesn't get worse.
So should she see like an improvement in her coordination, or do you think it will stay about the same?
Unfortunately, it will stay about the same. For the coordination aspect, she could use physical therapy, yoga, that's with the lifestyle changes, but for the things with like the numbness and stuff, I think that is going to be reoccurring throughout her lifetime, but at the same time we can make sure that that doesn't increase and spread to other parts of her bodies. So I have here a list of a lot of different medications that are used to treat MS, and it really depends patient to patient what works best. So we have injectable, oral, and infused medications, so you can completely choose what you think is best. At the same time, you can also try a couple different ones depending on. We're going to have to go back in and see exactly how much it has progressed so we know what the best route is. But just some examples would be Galena, Tespierta, and then the infused ones would also be Tyservry and Lemtrada. So definitely we'll sit down and talk about the best treatment plan you can take after we take a further look.
So I will have this for life.
You will, unfortunately. And if you do have kids, they do have an increased likely chance of having it as well. You're going to get through this, and there's all these steps you can take, and every single day the medications are getting better and more effective. And I do think that you're living at a good quality of life right now. Nothing is too drastic, so I think that if you're able to stop it and really slow it down for years to come, that you will be living the same quality of life.
Thank you you, doctor. Obviously, I'm really sad and scared, but everything you said is really reassuring.
We really appreciate it.
Of
Thank you.